The British Medical Association has called on new Health Secretary Wes Streeting to stop the dangerous substitution of doctors and to act urgently on the issue of medical associate professions who are being employed across the NHS without any defined national scope of practice, posing what the BMA calls a real and present risk to patient safety.
Unlike doctors who study for up to 7 years, physician associates only require 2 years of study.
Last week, more than 13,000 doctors added their names to a BMA letter warning of the profession's grave concern over the current use of medical associate professions in the NHS. The open letter warns of the risk to patients if concerns around the deployment of medical associate professions in the NHS continue to be ignored.
There clearly are concerns, aren't there, with how these PAs are being used.
The letter points to the widespread evidence of medical associate professions routinely being substituted for fully trained doctors on hospital rotas, and the worrying trend in general practice funding that has led to physician associates working in practical terms as GPs.
When you last went to the doctors, are you sure you saw a GP?
The BMA says NHS trusts are recklessly breaching safety requirements for medical associate professions relating to levels of supervision and prescribing laws. The letter makes 6 key asks of the new government, including a safe scope of practice, an end to the replacement of doctors on rotas, and an independent inquiry into how widespread the practice has become. The BMA warns that doctors are being replaced on rotas by medical associate professions around the country, leading to alarming situations where patients are being treated by unqualified staff.
I think there is confusion about what these staff are doing, because not only are they being labelled as physicians or specialists, but they're clearly undertaking tasks that are inappropriate for their level of training. And that goes to the very heart of the matter, in that no one has defined what these staff can and cannot do. We asked 18,000 doctors what their experience of these medical professionals were, and 87% of them said that they were witnessing practice that was putting patients at risk.
In general practice, at a time when patients are desperate to see their GP, the money that could be used to employ them is instead reserved for physician associates and other less qualified staff, leaving many GPs struggling to even find work. More on this startling revelation from BMA Council Chair Professor Philip Banfield.
A shocking 84% of locum GPs in England are struggling to find work. A third are being forced out of the NHS entirely, driven out by a cheapening of the medical workforce and the substitution of GPs with alternatives that superficially seem less expensive, but in reality cost lives.
The BMA is calling on politicians to turn this policy disaster around with visible accountability, transparency, and a proper scope of practice that can reassure patients they are always being seen by the right professional with formally assessed qualifications, skills and expertise for the task. This intervention from the BMA follows its announcement of legal action against the doctors' regulator, the General Medical Council, over the way in which it plans to regulate physician associates. Plans which the union says will mean a dangerous blurring of lines for patients between highly skilled and experienced doctors and assistant roles.
Helen Salisbury was one of nearly 19,000 doctors who responded to a survey by the British Medical Association. The results have been shared exclusively with ITV News. 87% believe that the way that PAs are currently used is at least sometimes a risk to patients, and 86% believe that patients don't know the difference between a PA and a doctor.
Physician associates are being permitted to take on many of the roles doctors have traditionally fulfilled. The NHS employs more than 3,000 physician associates in England and plans to increase this to 10,000 by 2026. The Royal College of GPs has also called for a halt to the recruitment of physician associates in general practice following a consultation with over 5,000 GPs. The college says its survey found more than 80% believe the use of physician associates in general practices has a negative impact on patient safety. The disturbing results also showed half of respondents reported being aware of specific examples of patient safety being compromised by the work of physician associates, including instances of misdiagnosis and inappropriate prescribing. And let's not forget the physician associates themselves in all this. We're all people who work incredibly hard, who, through no fault of their own, have been put in an impossible situation, one which is causing many of them huge amounts of distress and anxiety. This situation needs to be resolved urgently by the new Health Secretary, for them as much as for doctors and patients.